Dr. Parcells. I'm an orthopedic surgeon and I specialize in hip and knee surgeries. I'm a partner with CV Orthopedics and we're located in central New Jersey. In today's discussion, we're going to review the basics of knee arthritis. We're going to go through what arthritis is, how it affects the knee, how it's diagnosed, and the myriad of different treatment options that are available, including knee replacement surgery.
Arthritis is a condition that affects joints. So let's start this conversation by explaining what joints are. The simple definition of a joint is where two bones come together. And bones are primarily made to be strong, to resist the bumps we all take during the day-to-day life. They're coated in calcium, their surface is rough, and this is really a problem at the level of the joint where the goal is motion, minimizing friction, allowing two ends of the bones to glide together. So this rough, hard surface is not ideal for our joints, and so our body has come up with an ingenious way to address this issue. It's coated the ends of the bones where they meet up with cartilage, and the purpose of cartilage is to provide an extremely smooth surface so there's no friction and no inflammation. Our cartilage is so smooth that actually it generates less friction than rubbing two ice cubes together. Now, cartilage sounds wonderful except for one not so minor detail. The body does not know how to regrow cartilage, so it slowly wears out over time, like the tread on the tire of your car. And this cartilage wears out so your joint lacks the same lubricating capacity, lacks the shock absorbing capacity. So now you have raw ends of the bones rubbing against each other. And over time, this will create a lot of inflammation. So the cartilage is now being replaced with inflammation within the joint, and this inflammation is painful. It causes warmth, stiffness, redness, and that inflammation within the joint is arthritis. So in summary, cartilage loss causes arthritis, and arthritis is pain and inflammation in the joint. So let's now look at arthritis specifically within the knee. Here we're looking at an x-ray of the knee, and this is where the thigh bone, called the femur, comes into contact with the shin bone, which is your tibia. And the space between these bones is the knee joint. So if you want to ask where the knee is, it's the space between these two bones. And you know if the knee is healthy or if there's arthritis based on the space between the two bones. Okay, so let's look at this x-ray now. You can see on the outer side of the knee that there is a space between the bones, and that's great because it means that cartilage still lives there. Now in contrast, let's take a look at the inner side of the knee. Here you can see that there's no space and that the raw ends of the two bones are touching each other, and you call that bone-on-bone arthritis. There's no space, there's no cartilage, and there's a lot of inflammation and pain as a result. Okay, so now we're ready to talk about treatment options. And the important thing to remember throughout treatment considerations is that arthritis is very painful and many times very debilitating. However, it's never a life-threatening condition, and therefore you can approach the treatment slowly and really only recommend more aggressive treatments as the conservative measures fail. So we'll go through treatment options from the most conservative to the most invasive, which is a knee replacement procedure. So the first treatment options and the least invasive include physical therapy and anti-inflammatories. Now, therapy, remember that this is a structural condition, meaning that the cartilage is worn out. However, we have found that therapy can strengthen the muscles around the knee and actually reduce the amount of force and impact on the raw ends of the bones, thus reducing pain. So therapy works really well, even though it doesn't affect the underlying condition. Anti-inflammatories such as ibuprofen, meloxicam, there's a number of these medications that are all called NSAIDs, and they're great because they reduce inflammation. They're not so great because they have an adverse effect on your stomach, on your kidneys. They can have a various number of interactions with other medications like your heart medicines. So the general idea is that anti-inflammatories are great to get you through a flare-up of arthritis, but you really don't want to make that a long-term treatment option where you take it day in and day out. Another treatment option that's slightly more invasive is performing injections into the knee. The idea here is that you're putting medicine directly into the area of pain and inflammation where the arthritis is. Similar to therapy and anti-inflammatories, it's not addressing the underlying loss of cartilage, but it's a more aggressive way to reduce inflammation. And there's a couple different medications that can be used as an injection, and those include cortisone gel injections, which are known as viscosupplementation, or PRP injections, which are your platelet-rich plasma, using kind of the healing molecules within your own body to try and reduce inflammation and improve the overall state of your knee joint. Now, our other option for treatment, and this is the most invasive, is to perform a knee replacement surgery. And this really addresses the underlying issue of having raw ends of bone exposed without cartilage. And the idea here is to shave off 8 millimeters of the raw bone and the damaged cartilage, and to replace that with plastic and metal, thereby really creating a new joint surface. So instead of cartilage as the joint surface, you now have something artificial, and it is very effective at getting rid of the pain, but it is a surgery that requires some recovery.